I'm Star Leonard. I'm a PGY2. I'm kind of filling in tonight to go over our program and what we have to offer. So we're the PM&R program at Rochester Regional Health, specifically at the Unity Hospital. Rochester Regional Health does have two major hospitals within Rochester, Unity and Rochester General, and we are primarily at Unity. So just going over our health system, these are our Rochester Regional Health's purpose, values, and vision. We actually just released a new vision, new purpose. It's uplift humanity through care through our community. It's actually very helpful because it brought us a lot of wellness and healthcare opportunities through the system itself. Rochester Regional Health is a pretty vast health system within Western New York. I mean, there's at least 8 major hospitals, 2 of them being in Rochester here. And then specifically, we are through the Neuroscience Institute. So kind of how I mentioned, Rochester General Hospital, Unity Hospital. These are the different locations that we'll also be at for outpatient. Those are where we can go for PT, OT, speech therapy, our outpatient neurology, pain management, stroke. And then these are some of the academic aspects involved within the Neuroscience Institute. We do have a pain fellowship through LECOM, and then we can also work with RIT and research aspects. All of Rochester, I would say these places are probably 15 minutes apart. Traffic is not bad here in Rochester at all. I live in Greece, which is just right outside the city, and I'll kind of go over locations in a bit as well. So again, speaking about Unity Hospital, so it is a community hospital. It's 471 beds. Rochester General is much larger, but one benefit is free parking on all of Rochester Regional Health campuses for all employees. And then Unity specifically was ranked best in the region, and it's a great workplace. And within Unity Hospital, there's the Golisano Rehabilitation. So this is where we do our inpatient rehabilitation. It's been established since 1989. It actually used to be at St. Mary's Hospital, which was a kind of another location outside. It's a 25-bed inpatient rehabilitation. It's located within Unity Hospital, so quick access. We can do consult services, internal medicine. We can also do rapid transfers if needed. And it's really nice to just kind of have that in the same facility. It is CARF accredited for comprehensive integrated inpatient rehabilitation, stroke, spinal cord, and it was just CARF accredited for brain injury. And we do take pediatric patients on a case-by-case basis, but, I had the opportunity to actually treat a few pediatrics within rehabilitation, which is very convenient, kind of get early exposure to it. This is just a snapshot of the patients that we've treated in 2024, 470. On average, your workload is maybe 6 to 8. Even with the unit full, we try to space it out so then you're getting good exposure to a variety of rehabilitation needs. This link here, this is recorded, but you can go on a virtual tour if you just look up the Golisano Restorative Neurology Center. It'll walk you through the entire facility. And the virtual tour does not give justice. It's a very nice facility. And we work very closely with our PT, OT, speech, case management, and all of our nursing staff. So more specifically about our program, this is our core faculty. Dr. Singh, he's our program director. Zach's our program coordinator, and Dr. Namasivaya is our associate program director. Dr. Silverman's the medical director for Golisano specifically. We have Dr. Ransom, Dr. Zong, and Dr. Lesser. Dr. Ransom is primarily one of our inpatient providers. She also does some outpatient, and Dr. Zong really works with us outpatient and does a lot of spasticity management. I've gotten a lot of exposure in spasticity just in this first year. And then Dr. Lesser, he is neurology trained, and he's the leader of our EMG series, which I'll talk about in just a bit as well. These are our current residents, our PGY4s, Dr. Klein, Dr. Morrison, Dr. Kaler, me, Dr. Levin Francois, and then our new PGY2s, Dr. Domineni, Dr. Torres, and Dr. Bruckner. We do have PGY1 residents. We're an advanced program, but there is opportunity to get your preliminary year completed within Unity Hospital. It's very convenient. And so they're currently going through their PGY 1 year, and we'll welcome them with open arms in just short of a year. So our program, it's a 3-year, we have 3 advanced track ACGME accredited position. Again, inpatient, outpatient experience, a very diverse patient population. We're in kind of a suburban rural area. We take even patients internationally from into the Golisano rehab. Supportive environment and mentor. There is no such thing as a stupid question within our program. And then you're assigned a mentor kind of day one. Of course, you can reach out and be provided opportunities to obtain any other mentors that you would need, but you are just automatically assigned one as soon as you start. Teaching and research opportunities. So we are in partnership with LECOM and also RIT. So we have a lot of rotating students. We have a lot of rotating shadowers, even like PGY1 residents. They rotate with us. And so you have a lot of opportunity to teach, but also research as well. LECOM offers grants that you can apply for if you include their students in them. They offer 2 a year. And then RIT also offers research opportunities. Very vast discipline exposure, extensive EMG and MSK training. So our EMG, the first year, you will actually do that as a cohort as PGY2s. You do it all together. It's kind of an intro into EMG. And then we just kind of got off the ground our ultrasound workshop series. So we rotate between each joint and body system, and we do ultrasound with one of our other physicians that kind of just joined forces with us, Dr. Grisbowski. He's a recent graduate and just started on our outpatient. And then also injection and ultrasound training, as I've mentioned. So this is kind of a general curriculum. PGY2, you do 24 weeks of inpatient rehab. That's at the Golisano rehab. General outpatient PM&R. That's generally at Ridgeway, which is right across the street from Unity. Sports medicine, you get to work with Dr. Blonsky and Dr. Grant. Though they're not our core faculty, they're very integrative within our program. They also have a sports medicine fellowship, so you can work in sports outside. You can volunteer for opportunities, different meets, also RIT, and then also in the orthopedic urgent care. Very close with neurology. Our consult service is at RGH. It's a great opportunity. You get a lot of exposure, and what we like to call is we get to spread our rehab wings. So you get to go and kind of see what qualifies patients to come into acute rehab and, the certain qualifications, and then get started on some of the rehabilitation early while they're at the RGH. EMG, we do, like I mentioned, it's a 1-month course that you will do alongside with your other PGY2s. Pain and spine, that is outpatient, and then vacation is 4 weeks. PGY3, very similar. The only things that change is you kind of go down in your rehab as you advance through your PGY3, and this is supposed to be PGY4, apologies. And then you get to work with rheumatology, palliative care, and vascular. You'll see here they're mentioned as electives. So being a newer program, establishing formal electives, we're kind of working on establishing formal electives. We do have opportunities like rheumatology, palliative, vascular. You can do away rotations, and then because it is so new, we really get the chance to kind of expand our wings. If there is an elective that you really want to do, and if we have to offer it, you can do it. And if not, then you can always pursue an away rotation. And Dr. Singh and Zach are really good about working with us and making sure that you have all the paperwork and everything filled out. And so if you're interested in doing it, you can start sooner. We do also do continuity clinic that starts your PGY3 year. We do our P&O clinic that's dispersed throughout the year. It's with Hanger, and it's in our outpatient PM&R clinic, which is right there at Ridgeway. We did our ultrasound workshop, and then you can moonlight your PGY 2 year with PD approval. Recommended not at least trying until PGY3, just so you can get a good breadth of PGY2 and PGY3. These are some pictures of some of our didactics. So we do in didactics, we have a lot of guest lectures, and it's very helpful. So this was actually, there is a adaptive assistance for cars within town. and they come and they bring all of their wheelchairs. You're allowed to sample them. And so that was our race one day. Education, so didactics, it is mandatory, it is protected. It is Wednesdays from 1 to 4 p.m. It's at our Galzano inpatient rehab unit. It's based off a 12-month topic cycle. Right now we're on TBI. Within there, we do literature review, case studies, lecture, QI cases like morbidity, mortality, journal club. It's all within there. And then we also do exam prep, so SAE review, and then we also work on mock oral boards early within your PGY2. Research, as I mentioned, so within Rochester Regional Health, you do have library access to any database you can imagine. And if we do not have access, you can ask for it and they will get it. Again, the grant opportunities through RECOM or RIT, the M-based database. And then we actually just started an Advances in Clinical Medicine Research and Healthcare Delivery. That is our own personal Rochester Regional Health journal, just to kind of get some publications out there. It is very small. It just started, but it's free entirely. So, and then funding. So we do get our annual education fund. Every resident, these are current numbers. Every resident gets $750. And then you can get additional education fund opportunities up to $1,000. So if you present at a conference and you have a set time, you get an additional $1,000. You do have an on-call meal allowance. It's $500 annual. I don't know if this will apply for you, but at the beginning of our year, they let us decide if we wanted to use that money toward additional education. So if you didn't want to do your on-call meal allowance, then you can put that towards your additional education funds, which is very convenient. And then your PGY4 year, you do get additional funding for board review. PM&R recap is provided all 3 years for residents, as are some of our AAPM&R and AAP memberships. The memberships kind of fluctuate. I know last year it was New York State PM&R program, and this year it's AAP. So those kind of fluctuate. And then this is from the AAPM&R PGY2 resident retreat. It was very fun. If you're PGY2, when you get there, highly recommend going. Call coverage. Everybody asks about call. We do home call. It is truly the greatest thing ever. So our schedule is finalized the 15th of the preceding month. Which is very nice because it prevents schedules changing the day before. Coverage hours for call are weekdays, 5 p.m. to 8 a.m. and then weekends, 5 p.m. to the Monday at 8 a.m. We do round on the weekends. It is shorter, but so Saturday and Sunday and RH holidays, because you cover call for the holiday. So like I'm on call this weekend, so I'll round on Monday. So then those that are on the unit will actually have a day off. Rounding is typically 8 to noon. I mean, you kind of just keep things cleaned up, finish your notes, and then you go home. Vacation, we're allotted 20 days annually. Weekends are not included in vacation requests. It's recommended that it's 90 days in advance. Conferences are not considered vacation. Conferences are considered education. So that is very helpful. And then we do request that 1 week, if you're going to be off 1 week, you get it approved by the program director, just because you don't want to be set back later. 6 days, you're allotted 7 days annually, and then you just need a doctor's note if more than 2 days are requested off consecutively. These are some of our benefits. So our compensation, we just got a very healthy raise. So PGY 3, our rate is $80,000. It's very nice. And then also within our benefits package, so within our RH, you get your health, dental, vision, hearing insurance packages, your retirement plan opportunity for HSA, FSA, life insurance, legal insurance programs, pet insurance, even disability benefits. Professional liability insurance is automatically covered. I think it's $10,000. We also just got the employee assistance program. This is very helpful. It's free counseling. It also can help plan things. I have a meeting. I just got married. I'm trying to figure out how to change my last name, and it's just all these legal services that are provided. And then also workers' compensation and medical leave, extra perks, and just being a Rochester Regional Health employee. So you do get free membership at the RH Fitness Summer. a monthly cell phone reimbursement, also on-site childcare, and then also access to various discount programs. I use them frequently for traveling. Wellness, we do care about wellness. We do a quarterly event. Some of the past things we've done is we've gone go-karting. We just recently went to a Red Wings game. I know our first one was rock climbing. And then, just additional resources. We do have transportation. So if you're tired and say you had a long night at call or you just couldn't get home from work, call Zach. Transportation can automatically, you don't have to pay for it. They'll just get you home. We do get a monthly inpatient snack allowance. And so our wellness chair goes monthly, gets whatever snacks those who are on the unit want, and then bring them to the unit. The loan, financial retirement, and leave resources and assistance. You can also, through RIT, you can get 50% off tuition. There's so many education resources, Uplift You Wellbeing platform, and then the Health Advocate Employee Assistance Program. You're able to go to all of your doctor's appointments, no questions asked. It's beneficial to schedule them of an afternoon just so you're not playing keep up, but I ruptured my Achilles this year and there has not been a single issue with going to physical therapy or any of my doctor's appointments. And then through the rehabilitation unit at Golisano, there's so many events. We're just starting a cornhole tournament. We started an annual walk and roll. So we, take all of our patients out. There's food and games and just gets them out for fresh air. We do an annual patient reunion that's coming up here for us soon. All of our patients come back to the unit and we just kind of celebrate them. We do Thanksgiving dinner, the helmet drive. They do awareness events all year round. This was our pumpkin decorating contest through Rochester Regional, and then also Santa came to see us, so we got free hot cocoa. There's events always going on. Why Rochester? So Rochester, New York, third largest metropolitan city in New York State. Listed here against Lake Ontario. Lots of restaurants, outdoor spaces, family-friendly activity. Beautiful waterfalls. There's several festivals every year, like the 60 public golf courses. I actually didn't know that, but and then breweries, distilleries, and wineries. And then very affordable cost of living. I would say on average, like a 1-bedroom, 1-bath would be like $1,200. And it's right next to the hospital. Average of a 21-minute commute, no traffic. There are festivals year round, museums, parks, and entertainment. So there's the Strong Museum of Play. We do get discounted tickets year round. And then also for the month of September, you and 4 additional guests can go for free. The Fringe Festival, the Rochester Jazz Festival, Comedy at the Carlson, the Lilac Festival. These are just some of the views of the nature. The Finger Lakes are within an hour away. Buffalo's within an hour away, as is Niagara Falls International Airport. So it's very convenient, kind of a good location to be able to travel if you choose to.
You have 2 minutes remaining.
Perfect. And then this is just some of our information. So again, we are an advanced track PM&R program. So we do have 3 advanced tracks. Of course, the deadline, November 30th. It is not required, but it's encouraged to also apply for the preliminary Unity Internal Medicine program. There are 3 spots set aside separately. If you interview through us, you do not have to interview, to be considered for PM&R, you do not have to interview with Unity Internal Medicine, and you would just apply separately. And there, if you have questions, our coordinator is actually going to be the best one to reach out to, just because he's with more of the information more frequently than I am. You can follow us on our Instagram page, and this is also our website. If there's any questions, I can answer them. And then Sai also is on board if there's questions about the internal medicine program, because he did go through that. I did not do my intern year here, so.
Yeah, and I can leave my email or something. You guys can ask me whatever. Like Star Pension, I did do my prelim year at Unity, and then Also, when I was a med student, I did my 3rd and 4th year, the same hospital. So, any questions? Because I don't know we're running out of time. He is more than welcome to email me or whatever.
You guys actually have one question in the chat from Devanshi. She's asking if it's hard to find moonlighting opportunities. Are there any community involvement apart from with the hospital?
So moonlighting opportunities, I haven't ventured into that realm yet, but we do a town hall through the GME office monthly with our GME director, Dr. Allweiss, and he's the best. He's always sending out information. So if moonlighting is something that you're interested in, I mean, he has a whole pamphlet of opportunities, how to get licensed through New York, etc. And then community involvement apart from within the hospital, absolutely. I think Rochester gets a little not enough credit. There's so much to do here. There's so many opportunities. I'm getting ready to volunteer for a disabilities musical. I mean, there's just so much. I just couldn't put it in 20 minutes of a presentation.
And actually, you guys are out of time. And thank you so much for a wonderful presentation and both of you joining us for the night.